Welcome to the Center for Advanced Reproductive Services at the University of Connecticut Health Center. This video focuses on the evolution of the various medications used in the in vitro fertilization process. At the Center for Advanced Reproductive Services, our sole focus is in providing the highest standard of individualized clinical care to people experiencing infertility in an environment that is caring, sensitive, responsive, and knowledgeable. We understand the emotional and healthcare needs of infertile couples, and we focus on what they want most, a baby. We have expertise in the latest technologies and treatments in infertility. We also offer the compassion and support services that will help couples cope with the special emotional needs in dealing with fertility problems. Our highly trained, compassionate staff will help each step of the way, and we'll start by giving couples the hope, support, and medical care they need to conceive. This video is one small part of an ongoing educational series that we hope will help to educate and inform you about the IVF process. The first infertility injections that were developed were made from human urine. Hormones were removed from batches of urine taken from postmenopausal nuns and then processed. As a result of advances in technology, the same hormones are now manufactured in the pharmaceutical laboratory. These newer products offer high quality, purity, and consistency from batch to batch. Because of the technology and cost associated with manufacturing these medications, they are expensive. Here are some of the different brands of medications that may be used in an IVF cycle. Most of the medications that are used for IVF are injected with a very small, thin needle just under the skin surface in the abdomen or thigh. This is called a subcutaneous injection. Progesterone is an exception to this rule, as progesterone is injected into the muscle in the area above the buttocks. This is called an intramuscular injection. Some of the commonly used medications are now available in easy-to-use pens. Progesterone is a natural hormone required to develop the uterine lining and support a pregnancy. It may be given vaginally or as an intramuscular injection. There is some evidence from research studies to suggest that pregnancy rates are higher when progesterone is used intramuscularly. Because of this evidence, we recommend intramuscular progesterone for our IVF cycles. Based on a patient's hormone levels and ultrasound results, it may be possible to switch from intramuscular to vaginal progesterone once a healthy pregnancy is established. Your doctor will make specific recommendations for progesterone use for your cycle. With any medication, there are always potential side effects. It's important to recognize that most patients do not experience significant side effects from the medications used in the IVF process. Here is a list of potential side effects that may be experienced. Most of the side effects are very mild and short-lived. A potential, although rare, side effect of the medications used in the IVF process is ovarian hyperstimulation syndrome. OHSS is a condition in which the ovaries become enlarged. This may result in abdominal fullness, pelvic pressure, pain, bloating, and accumulation of fluid in the abdomen. The severe form of OHSS is very rare, occurring in less than 2% of cycles. Most cases of OHSS are managed on an outpatient basis and patients don't need to be hospitalized. This may require additional blood work, ultrasounds, and checkups in the office. In more severe cases, fluid through an intravenous line, removal of fluid from the abdomen, or a brief period of hospitalization may be necessary. OHSS usually resolves spontaneously in 1 to 2 weeks. At the center, we take many precautions to prevent OHSS from developing. These measures include close monitoring during the cycle and using the lowest effective medication dose possible. In some cases, medications may need to be stopped temporarily during the cycle in a process called coasting. In certain patients who are at risk for OHSS, despite these measures, cycle cancellation may be necessary. In some cases, freezing all of the embryos and postponing the embryo transfer may be recommended. Most studies have found that the medications that are used to induce ovulation do not increase the risk of either ovarian or breast cancer. The American Society for Reproductive Medicine came out with a position statement in 2002 on this topic. They stated that more recent research indicates that patients taking ovulation-inducing drugs face no greater cancer risk than the general population. In order to achieve a successful pregnancy with IVF, there are some steps that are critical to the process. These are having a good response to the ovulation induction medication, successful fertilization, healthy embryos for transfer, a positive pregnancy test, appropriately increasing levels of pregnancy hormone, and confirmation of pregnancy in the uterus with a fetal heartbeat on ultrasound. At the center, we hope that each and every one of our patients has success, and we do our very best to achieve that goal. The Center for Advanced Reproductive Services is dedicated to advanced infertility treatment through the combined application of high-quality patient care, clinical education, and research. At the center, we strive for excellence in patient satisfaction and clinical outcomes in a responsibly managed environment. Learn more about us at UConnFertility.com or call us at 860-679-4580.